I always make this saying that if you're trying to build the best body of your life, right? You're like, okay, I want to be Mr. GQ. If you go to the gym once, but you eat like trash, you are not going to have the best body of your life, and your skin is no different. One treatment is not going to do a total overhaul on your skin, just like one day in the gym is not going to give you a six pack.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Tori Cohen, a nationally certified physician assistant and the founder of Bare Radiance Aesthetics in Westminster, Colorado. She began her career in family medicine, where the patient load was high, the charting was endless, and internal morals were loudly reminding her she didn't go into medicine just to sprint through 7-minute visits. Today, she blends medical expertise with an artist's eye to create natural, confidence-building results through injectables, skincare, and advanced laser treatments. She is known for educating her patients with clarity, humor, and heart, and for building a practice rooted in trust, community, and truly personalized care. So, Tori, welcome and glad to have you here.
Yeah, thanks, Daniel. I'm so excited to be here.
Yeah, so let's start off with this, Tori. How did you first get interested in the medical field? We'll start kind of like the highest level in the medical field.
Yeah, that's a great question. So it was actually family based. My father he was a flight paramedic for a long time. And so I kind of watched up or grew up watching him be a model for me. So he started out, like I said, as a flight paramedic. And then he transitioned into owning his own business. And I think that for me, being a young child and seeing you can blend this beautiful career of medicine, but also business into one. I think that really sparked my interest in Bare Radiance as a whole. But medicine, it was all about helping people for me. I think that it's actually funny enough, when I was in physician assistant school here at CU, I was in the rural track. So I really wanted to provide care to rural areas that didn't have access to great care. And so that's really where my passion started for medicine, was just helping people and empowering people to have the knowledge to make good informed decisions about themselves and also their health.
Okay. And so what was it that caused you to make that transition into aesthetics then?
Yeah, that's a great question. So it is kind of ironic, right? Because you think about rural medicine and that is completely different than the aesthetics realm. But I do think that there's a lot of similarities there. I got into family medicine wanting to provide education to my patients, to give them a foundation where that they knew what this medication would do for them or what this treatment would do for them, but also the risks. I think as a medical provider, it's extremely important to provide all the treatment outcomes and have a shared decision making with the patient, right? Like this, they're in the driver's seat of their health. And I think aesthetics is no different. I was in family medicine and I was pregnant at the time and spending way too long with patients because I felt that they deserved that. And I would get home and it would bleed into my home life because I was at home charting, calling back on labs, doing all the things. And my husband one day, I distinctly remember this memory. We were sitting in bed. I was charting for the day because I didn't get anything done when I was in my clinic day. And I was just exhausted. And he goes, honey, I'm going to turn out the lights. Are you ready to go to bed? And I said, honey, I probably have 2 more hours of work left to do. I can't turn out the lights yet. And he looked at me and he said, why don't you make a change? Like this has been going on for weeks. You're exhausted. Your social battery is drained. Like how can I help you? What can we do? And I think in that moment was so pivotal for me because I didn't think that there was anything else. I was like, I went to school for the longest time. I'm in family medicine. I'm helping patients. I'm doing what I want to do, but it wasn't in the system that I wanted it to be in. The system was draining me. It wasn't the patients. And so we kind of had this epiphany together where I said, I was getting these treatments done personally myself, and I love it. I was like, you can really make an impact on people's, obviously their physical appearance, but their internal confidence. And so I said, if I could do anything, it would probably that. And he goes, well, then let's do it. And he signed me up for my first aesthetic course. It was 2 weekends after that, and everything else is history. I mean, I transitioned a little bit into aesthetics. I dipped my toes in the water, and now I'm fully in aesthetics. I left family medicine, and I feel so grateful to be able to do this. I can empower people. I can provide them all the treatment options for whatever they're facing, and it's a really similar modality where we get to sit together and we get to make some real change to their health. And I think that that's been really powerful.
Yeah, no, that's an incredible story, that journey you took to get from where you were to where you are now, and especially with your family or your dad being an entrepreneur. I guess that also kind of led to you having your practice now. So,
Absolutely.
okay, so now that you have this practice, I want to talk about some of the treatments that you offer to your patients and to your clients. In particular, I want to dive deeper into combination treatments. Because I think that if people, I mean, people who have gotten aesthetic treatments before, they're familiar with combination treatments. But for people who are not aware at all about aesthetic treatments, I think combination treatments might be a little bit foreign to them. They just think, oh, I just get Botox, or oh, I just get filler, or whatever it is. So could you talk about why do you really do a lot of combination treatments? What's the purpose of it?
Absolutely. So I feel like this is our bread and butter. And I have this joke that I say all the time in clinic. If you're sitting in my chair, you are hearing this. I can freeze or I can fill 50-year-old skin. So if I have a 50-year-old sitting in front of me, I can put some Botox in there to freeze the muscle. I can fill her up to bring that volume back, but it's not going to change anything about her skin. It's still going to be 50-year-old skin. So I think where people can miss the mark is they come in quarterly for their Botox and they're like, oh, I'm here for my next Botox treatment, but they're not pairing any skin rejuvenating treatments with it. So, we have a joke that we can kind of pick the people out of the room who've had Botox but who haven't had skin treatments, and
Mm,
those aren't our patients because we feel so like we are so we think that it's so important to educate our patients and how to make change to the skin. And ways that you do that are through laser, through medical grade skincare, through microneedling, through chemical peeling, right? We're actually getting to the root or the etiology of what is happening in an aging process, right? When we are freezing a muscle, right, we're trying to control fine lines and wrinkles. But why do we have those fine lines and wrinkles? Well, we have them because of collagen loss and collagen breakdown, right? So, doing these combination treatments or pairing a laser with their Botox is going to freeze the muscle, but also help rejuvenate the skin. And that's how you really start turning the clock back on time, where 50-year-old people are now looking 40. They're not looking 50 with frozen skin. So, I think that pairing the combination treatments is amazing. And I tell my clients all the time, they aren't the experts in this, right? They don't need to know this. They
mm,
need to sit in front of us or someone who's well educated and who can explain these treatment options to them, right? A laser might not be beneficial for everyone, and some people might not want the downtime of that, and that's totally okay. But there's things that we can do to change the skin. That's a topical serum that you're going home with and you're applying to your face every single day, like a vitamin C
mm,
or a retinol. So I think the aesthetics industry can feel overwhelming for a lot of patients and clients,
mm.
but that's where we're here to kind of walk them through the journey of like, tell me what you're comfortable with. What does your day to day look like? What do you do for work? Are you a mom? Do you have downtime? And that really allows us to be in the driver's seat with them and pick the treatments that best suit their lifestyle, and give them a really good holistic approach.
Okay. So sounds like there's a lot of customization in this because it's really dependent on the individual, their skin, what they're looking for, their goals, etc. But are there some common combination treatments that you kind of find that you're doing for most clients?
Yes. I would say most clients in an ideal routine are doing a medical grade skincare routine that they're taking home with them.
Mhm,
They're doing some sort of laser treatment, whether that is a BBL heroic, which is targeting kind of the pigment in the skin, the redness to the skin, or like a resurfacing laser, like Moxie, which is collagen stimulation,
mhm,
and then doing some Botox. I think that that is kind of a good foundation to get somebody started where we're working on multiple modalities. I always make the saying that if you're trying to build the best body of your life, right? You're like, okay, I want to be Mr. GQ. If you go to the gym once but you eat like trash, you are not going to have the best body of your life, and your skin is no different. One treatment is not going to do a total overhaul on your skin, just like one day in the gym is not going to give you a six pack. And so I think framing the skin health, and if you really want to take an anti-aging approach to your skin, it really does require these multimodality treatments. And so I think if we could get someone started on some good medical grade skincare, do some collagen stimulation with a laser, and then pair some neuromodulators, I think we can get pretty good results if you give us some time with that.
Okay. And with these combination treatments, is it really kind of tackling a lot of the different, I guess, end results that people are looking for? So, like when I think about if I want to get an aesthetic treatment done, okay, maybe I have wrinkles that I want to kind of smooth out, or maybe I want to tighten my skin, or maybe I want to get that glow back and make it look younger. Like, does this combination treatment kind of address all of those ones at one time?
Absolutely. So when we are aging, right, you kind of alluded to, we age from multiple layers, right? We age from our skin to our muscles to our fat pads all the way down to the bone. So there are physiologic changes happening in all layers of the face. And so being able to pair a laser which targets the skin, a neuromodulator which targets the muscle, being able to pair multiple treatments allows us to address the aging process from multiple layers. And so I think that that's when it really becomes a whole overhaul and you really have some good, meaningful change in anti aging and in people's concerns. If I could wave a wand and say, we're going to do one thing and you're going to walk out of here looking 10 years younger, that would be amazing. But realistic expectations are really important. And so when people sit in our chair, we say, like, how much time are you ready to commit to this? You know, these things are concerning you. And I hear you when you say that. This is what it's going to take. And how invested are you in making that change? And I think when you have someone who's ready to make the change, they're ready to hit it from all angles. And so they really get wonderful results because they're doing that multimodality approach.
Okay. And so now I'm sure this is going to depend on the individual, but for most people, what can they expect as far as how many times they need to do this treatment? Is it twice? Is it five times? Is it 10 times? And then also, what's the recovery time in between? I know I think for a lot of these, there's not much downtime, but like you shouldn't just hit it day after day after day. So
Yeah,
what's the frequency and then the time in between that they should give it so that they can try and get that end result?
absolutely. So it's different for everyone. I wish that there was a standard, and they do have, for example, we use Cyton modality for our lasers. They are phenomenal, and they do give some general guidelines on, doing 3 to 4 treatments, and then you can maintain with 1 or 2 a year or whatever that looks like for you. For our clients, I really like to take a personalized approach, right? Because we may do one laser, it may lighten your pigment, tighten your skin, and you may be really excited about those results and say, I'm happy with where I'm at. I'm ready to roll into my maintenance treatment. But if I did that same treatment on a different person, they may see improvement, but they want more to go.
Mm.
So I think it's kind of talking people through when we're doing these treatments. Do we want it better? Do we want it totally gone? And when we have those conversations with clients and with patients, then we're really able to draft a protocol specific for them. I don't think these generalized guidelines of like, oh, do three spaced 4 to 6 weeks apart and wait, I don't think that works for everyone. And I think, really pigment specifically in the skin, right, can live in different layers. And so if it's a superficial pigment that we're trying to pull up, it's going to come up with maybe one treatment. If it lives deeper in the dermis, it may take a few treatments. And so I think that setting a generalization can be really, really hard. I tell people in general what to expect if you're trying to correct something in the skin. So if something is already there, it's going to take a lot more work to correct. If you're trying to maintain what you have, if you're happy with where you're at and you're trying to maintain that, that takes a lot less work.
Okay. Now, Tori, you alluded to this, but as far as what you're doing outside of getting the actual treatment, like you mentioned, as far as like eating healthy, working out, things along those lines. But I guess I think the answer to this is obvious, but how important is it to do those things outside of just coming into the practice and getting the treatments done? And also, like a follow-up question on that, is it okay just to eat healthy, exercise, don't do just your obviously bad things compared to actually doing like some type of skincare routine? Like, kind of what's the difference? Like, can I just get the treatment from you, live a fairly healthy life, and be okay? Or should I really be using kind of additional, I call it products, outside of treatment to get an even better result?
Absolutely. So I think that you can always enhance the results that are done here in this clinic by the things that you do at home. And I think that that's really impactful. For example, one of our lasers called the Moxie laser, it picks up on a water chromophore in the skin. So I tell patients before your treatment, 2 weeks before your treatment, I want you to focus heavily on hydration, drinking a lot of water prior to that treatment. I want you to start on a topical agent that's going to increase water in that skin, whether that's a hyaluronic acid or a hydrating B5 gel or things like that to do at home to really maximize the outcome of the procedures that we're doing here in clinic. And it goes with anything. Like I'm sure a buzzword in aesthetics right now is PRP or PRF and kind of using your body to stimulate its own growth factors and things like that. And I think that PRP is amazing. We do that here. But I also think you need to look at the candidate in front of you trying to come in for PRP, right? If I have a patient coming in, she's in her 60s, she drinks a bottle of wine a night, and she's a smoker and doesn't exercise, her PRP, her platelet rich plasma, is not going to contain as much healthy growth factors. So for her, she might not be a great candidate for PRP or for PRF. Whereas if you're working out, you don't smoke, you don't drink, you live a healthier lifestyle, then you're probably a better candidate for a PRP. So when you sit in our chair, it isn't just about like, let's get this one treatment done and let's send you on your way. No, we're talking about your lifestyle. What do you do for work? We want to know all of these things because then we can recommend treatments that are personalized to you and make sure we provide you with the appropriate pre-care and post-care to maximize your results because we we get an hour and a half with you in the chair. But when you get home, you've got to do your homework. And so we want to make sure that you feel really comfortable doing that pre-care and aftercare, but it's our job to set you up so you have a really successful treatment and a great outcome.
Okay. Now, when it comes to these type of treatment, like I'll talk about the combination treatments. What misconceptions would you say that is very common that you hear from your clients about these types of treatments, or maybe even myths that they believe?
Yeah, that's a good question. I think a lot of myths that people believe with combination treatments is I I think it's more of a pain perception. Like I feel like people think, "Oh, we're doing more treatments. That's going to be more pain inflicted." But I don't think that that's necessarily true. I mean, for myself, I'm a mom of two. I'm busy. I don't have time to be in an aesthetic chair myself getting treatments once a month. That's just not feasible for me. So if I can get multiple things done at once and save the time, I would much rather do that. The pain is usually, it's not any more increase in pain having two procedures at once. I think it's just the perception of that. Like, oh, I'm doing a laser and Botox that it's going to inflict a little bit more pain because I'm doing it all in the same day. When realistically, you're numbing for a laser, so your Botox is probably going to be a little bit easier that day because you have some topical anesthesia to the skin. So that is sometimes there can be perks of doing combination treatments, and it can actually reduce the pain.
Oh, okay. So it actually may be the opposite. There may actually be less pain, and then not only that, but I guess it's more of a mindset shift of you're saving time.
Absolutely. You're saving time and we're getting you the sooner that we can start stimulating collagen in anyone, right? Because collagen stimulatory treatments, they take time, right? I feel like we're in this world where everyone is like, I want to look better and I want to look better yesterday. And collagen stimulation doesn't work that way. And so the sooner you can get in on these treatments, the quicker that you're going to start building that collagen back and really making a difference in the skin. So I tell people, if you're sitting in our chair today and you're like, should I do a laser or should I do Botox? My answer is always both. But if that doesn't feel right for you, I would start with a laser. Like, let's start building some collagen and really making some change to that skin.
Mhm.
And I think that that's where our approach is a little bit different. Is we really focus on the physiology of aging and addressing that first.
Okay. Now, I want to shift tracks a little bit because I want to talk a little bit more about building community, which was one thing that you were really big on. So tell me about that. Like, why has been building a community something that's important to you, and especially within your practice?
Absolutely. Well, I think aesthetics can be a space where there's a lot of information out there. There's a lot of overload on social media and TikTok and things like that. And a lot of the time, our clients are coming, sitting in our chair, and they're being exposed to all of these things. And they're looking at me saying, well, I have a 12 product routine and I'm not sure what's doing what. And now I have this big acne flare. And so I think that it's really cool that we've created a space where people feel comfortable and confident to sit in that chair and to tell us that. And what an honor it is for us to say, hey, I'm so glad that you're sitting here and you're asking our opinion, and let me tell you why. And so I think the community really starts between our provider and our client and our patient. That's where it started, was in this room. And as we've started to grow, we've kind of built this network where we get to put all of our patients together in different formats, and they get to have those conversations amongst themselves, like, oh, I also saw this trend and Tori told me this, or Katie gave me some advice on this. What did they tell you to switch to? And so I think it's really cool when you get to build this community of women who are really empowered, and we put them all in the same room and get to share experiences and share what they're doing at home for their skincare routine, or what their life looks like outside of this. I think that it's amazing. And Bare Radiance has really become a place where we get to allow women to sit in a room, talk about the things that make them insecure, if that's comfortable for them, and how we can make a change in that. And I think for example, like putting a lot of our clients are just like me. They're moms. They are in this place where they're in a total different space in their life. And I remember after I became a mom, I looked in the mirror and I'm like, wow, who is this staring back at me? And this isn't who I thought would be looking at me. And I feel like a lot of my clients feel that way. And it's very cool to be empathetic and to really feel what they're feeling and say, hey, we don't have to feel like this. And there's things that we can do that won't change who you are, but that will make you feel more empowered and more confident. And now we've created this just huge community where we can empower women, where we can educate women, and we are just at the end of the day friends. And I think that that is really cool.
Okay. And that's pretty amazing to be able to create a community like that. And that leads me into my next question is that let's say someone is looking for that kind of community or that provider who can kind of get them the end results using combination treatments, but they don't know who to look for. Advice would you give to that person as they're doing their search to try and find that one provider who is going to be able to give them that sense of community, be able to get them results, and then make them feel comfortable?
Absolutely. So I think, and I'm kind of putting myself in the shoes of being a patient or a client because I have been that. And so the things that I've done when I'm looking for someone is I think word of mouth is huge. So look to the women who are in the space with you, whether they're colleagues, their friends, their sisters, sisters-in-laws, people in your community. Maybe it's the mom at the dance practice that you're going to, or when you're dropping someone off at daycare. I think referral by word of mouth is huge. That's what's grown our business significantly, is people hearing about us. Oh my gosh, my mom looks so great. What are you doing? How can you help me? So I think, look to the people around you. And then once you do that, verify them. So whether that's through Google reviews, whether that's through a consultation, kind of sitting them down and asking questions, and vetting your providers. I want my clients and my patients to feel empowered. Ask me when my last advanced laser course was. Ask me when I took my boards last. Ask me when my last anatomy course was. I think continuing education is so important in the providers that you pick. So I think you should you should never feel awkward or bashful for asking those questions. Feel empowered to do so. And the provider sitting in front of you will give you all of that information. And if they can't, that might be a red flag to try and find somebody new. But I think a lot of women, they have a general idea of what they want in a provider and in a practitioner. So I say interview them. Like, let's give the power to the patients and the clients to sit down and grill us. I'm happy to answer all those questions. And I think that the injectors or providers that you're seeing should be too.
Great advice. Great advice. Now, Tori, throughout your experience, I'm sure that you've had some particularly challenging cases or even just memorable cases. Is there maybe one story that comes to mind that you're able to share of just one of those cases and how you're able to get them a great result in the end?
Absolutely. And this story is actually going to be probably a little bit different than what you would be expecting for a challenging case. But not too long ago, I had a patient come in and sit in my chair, and she was at a point where she wanted an aesthetic treatment that I didn't feel would benefit her. And so, what that looked like is she had had work done by another provider. It was the first time that I was seeing her here in my chair. And she said, I'll walk you kind of through exactly what had happened. She had had her lips done with another clinic, and she was sitting in my chair and saying, I want more. I want a little bit more definition, a little bit more plumpness to them. And I really hold our values of maintaining natural anatomy, natural ratio seriously. And so I had a hard conversation with her that said, look, based on facial balancing, right? We use all these lines and measurements and things like that to kind of stay in proportion. And I said, I don't think this is a good treatment outcome for you. Like, I don't think that that is a treatment that would really benefit you. We focus here on natural enhancements. And I think that that would kind of throw things out of proportion for you. And here's why. And I did a bunch of drawings for her. I kind of laid things out, took pictures from her side profile, her front profile. And it was a challenging and tough conversation to have, because in the aesthetics industry, I feel like when people have an idea of how they want things to look, or how they envision themselves, it's a delicate line. But I think one thing that I pride myself on here is being honest, being truthful, and not doing anything to my clients that I wouldn't do to myself. So I had that conversation with her. Like, I wouldn't add any more to myself. I don't think this is a treatment that is going to give you a lot of added value. But, if we brought out your chin a little bit more or did some facial balancing, then I think we might be able to add a little bit more volume to the lip. But how it's sitting right now, I don't feel comfortable doing that. And she was very receptive. And she said, I just want to say thank you so much. And at the end of the day, the hardest part of my job that day was telling her, no, like, I don't think this is going to benefit you. I don't think this is a good treatment for you. I wouldn't do it to me. And I think of you as me, and I don't want to do that to you. And here's why. And so it was a challenging conversation to have, but we have those conversations quite often at our clinic. And I would want someone to tell me the same thing. I feel like we need a sounding board sometimes for aesthetics, and your provider should be that for you. So that was the challenging case that we had, was just saying no. But I feel like I've gotten more comfortable saying that as time has gone on, and now it's kind of an easy task for us.
Yeah, it's actually a great story you bring up because I think in many situations, saying no is just as important as saying yes, we can do it, or if not more so. Because I think that
Absolutely.
kind of goes into the part of how do you find that right provider, where if the provider is telling you, no, no, like this is not going to help, like I'm not going to do it, that actually I believe inspires more trust because it's like this is the expert, like they really know what they're talking about because they know enough to say no, it's not going to help. So I think it is very important you bring up stories like this. It's not all about the sunshine and rainbow. Sometimes it's like, hey, this is not going to help you. Like, it's just like anything medical. It's like, hey, this is not going to help you. So you need to advise them like you really have their best interest in mind. So
Absolutely.
yeah.
Yeah, I think it's really important that us as providers kind of take on that responsibility of not seeing aesthetics as an industry that is financially based. I could have easily said, like, oh, yeah, we can put another syringe in and you can pay me for an hour of my time. But that's not what aesthetics is to me. And I think that it's really important as providers that we educate and we give the patients our honest and thoughtful opinion. And, it could have gone another way where she said, well, this is what I want, and I'm walking out the door. And I would have said, okay, that is totally fine. You're going to find an injector that mirrors you and that fits you. And that's just not me. And that's totally okay. But
Yeah.
I do think that as an injector and as a provider, I have a responsibility to uphold to my patients. And I'm honest. If I'm not doing it to myself, I'm not doing it to you.
Mhm. Very well said. Now, Tori, where do you think the future of aesthetics is going?
Yeah, I think this is a really exciting time for aesthetics. I think we are kind of branching into this era where we are starting to focus more on biologics and using the body to heal itself. We're actually going to be expanding here pretty soon to include some more functional based medicine when it comes to aesthetics. So, for example, if we have an acne client, right, and we have done it's it's cool in my standpoint because I have the Western medicine training and I also get kind of more of the non-conventional functional medicine training, which I've been learning. But we have a patient who has extremely bad acne, right? And we are treating her with all the topicals that we can, and it is just not touching it, right? We're doing the treatments, we are doing everything possible, and it's not getting better, right? And my traditional Western medicine brain would tell myself, okay, well, let's start her on an antibiotic, or let's get her on some spironolactone or a medication to kind of reduce acne flares. And then my more functional brain is telling myself, well, no, let's dive a little bit deeper. Like, let's figure out what's going on internally. What are we eating, right? Is it dairy that's causing this inflammation? Is it an excess of vitamin B12, which we know can kind of trigger acne in patients and clients? And so, pretty soon, we're going to be bringing on a little bit more holistic care where we can draw the blood and look and see, is there another trigger that's causing this acne that we just can't get under control with traditional therapies? So I think that's kind of the wave of aesthetics, is starting to look at things at a basis of the genomic level,
Okay.
or the blood levels, and kind of using these pieces because we know the outside is just a reflection of what's going on internally.
Mm,
So let's start taking a look internally. And I think that that's something that's going to be coming.
okay. And you kind of talked a little bit about this already, but I want to kind of dive down deeper into what's your vision for your practice, Bare Radiance?
Yeah, that's a great question. And honestly, I think the vision for Bare Radiance has evolved more than I could have ever dreamed of. I started in a one provider room, and it was just me working late hours and late nights, which I was excited to do because I was really passionate about aesthetics.
Mm,
And that's really where I saw myself being. And over the last 2 years, we have grown to a space where now we are kind of we're involving more of our immediate community, and we're kind of finishing out construction right now on a space that has 5 rooms. We're going to kind of really be expanding and bringing on other providers. So I think the vision for Bare Radiance is just continued growth, but growth that's always patient first. Um, we put them first in everything that we do, even crafting this new space. I was in it actually this morning, lucky enough with my husband, and I was walking through the layout and I said, well, I can just envision my patient sitting here with a cup of coffee at the coffee bar, walking back to their treatment room, giving them a cozy blanket to put on. Everything that I do with Bare Radiance is patient and client centered. And so I think my vision is truly through them. And I'm really excited to grow and expand, but with them at our forefront always, because we would be nothing without them. And I'm just so grateful.
that's a wonderful vision. Wonderful vision, Tori. Well, this brings us to the end, Tori. I have one last question for you, but before I ask it, I do want to point people to your website at bareradianceaesthetics.com. Now,
Thank
last
you.
question for you, Tori. What does beauty mean to you?
That's a good question. Beauty is such a generalized term, and I think it's different for everyone. Beauty specific to me is inspiring confidence from within. So that story that I was telling earlier, where I looked in the mirror, I had 2 kids, and I'm like, who is this staring back at me? I think beauty is an internal reflection on, I think it's something so personal. And in that moment, I didn't feel beautiful. I remember looking in the mirror and being like, wow, I this doesn't feel good to me. But I think now beauty has taken on a whole new meaning, and it's giving people the power to to do whatever that means for themselves. And I think it comes from the confidence from within. I don't think beauty has anything to do with an external value. I think it's totally coming from within, and confidence. I think having confidence, it is the definition of beauty, and that's an internal confidence, not an external one.
Well, there you have it. Tori sharing her expertise. So, Tori, where can people contact you in your practice?
Yeah, absolutely. So there's a few ways to find us. I think Instagram at bear underscore radiance underscore aesthetics is a good place to start. You can kind of always reach out via DM there if you have any question, concern. Hey, I saw this trend on TikTok. We love to provide education through that platform. Also, feel free, my email is Tori at bearradianceaesthetics.com. So you're always welcome to email me at any time with any question, concern, anything. I love hearing from other people, hearing their experiences with their injectors that they've had, asking questions. We're here to walk you through this journey wherever you're at.
Awesome. Well, Tori, this is great. Thank you for coming on. Thank you for sharing your expertise, and thanks for sharing your message.
Yeah, Daniel, I appreciate you guys and the Beauty Talk platform for inviting me on. It's such an honor, and I'm excited to stay in touch.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.